All right. Hello, hello. Good morning, everyone. Happy Monday. Okay. So before we get started, just one word about the quiz. I'm sorry that that wasn't visible at the usual time. Thank you for those of you who alerted me to that. So for those of you who didn't check on Sunday, at the point when I found out that I didn't click the button to make it visible, I'll extend that deadline to this evening so that you have a chance to do those practice problems. Sorry about that. If it doesn't show up again in the future, please do let me know. I do set them up to open on Thursdays, so they should be open by Thursday afternoons. Okay. So that said, any questions before we begin continuing to talk about our respiratory system? Okay, cool. So we will pick up where we left off. Okay. So at the end of Friday, we had just started to talk about the forces that allow air to move. So we were talking about pulmonary ventilation, which is a component of our external respiration. So our gas exchange with the external environment. Okay. And we're thinking about the fact that this follows the same rules that the blood did moving through our arteries. So we're still talking about bulk flow. So we're still thinking about a pressure gradient driving flow. So we're still going from a high pressure area to a low pressure area. Okay? And we have definitions for air moving in, air moving out down those same gradients. So inspiration is going to be following really like a negative pressure in the chest, in the thorax, pulling air towards that negative pressure. And expiration is going to be when we create a larger pressure in your thorax, in your chest, than we have in the room around us. And so air is driven out of your body. And we will also see when we talk about our lung volumes and capacities that we can measure volume of air in the lungs. Happens to be the case that between breaths, you are at your functional residual capacity. So here's where we were. I had highlighted for you that among these pulmonary pressures, we have many values, many things we can measure, but our two most important numbers to compare are going to be our atmospheric pressure, so the pressure in the room around us or the pressure outside. That's not something that we can control, and it's not something that tends to vary. But what does change is our intraalveolar pressure. So in the alveoli, in those little sacs, at the very ends of all this splitting of your bronchi into bronchioles, into respiratory bronchioles, into these alveolar sacs, right? That pressure, we're trying to get the air into those alveoli. So that intraalveolar pressure is the one we care most about. So if it's lower than our atmospheric pressure, that means you're going to be pulling air towards those alveoli. If it's higher than our atmospheric pressure, we're going to be pushing air out. So the other sets of numbers here on our pulmonary pressures represent things that kind of drive this process, right? So we can change our intraalveolar pressure. We're going to see that it changes by changing the shape of the thorax, by pulling on the bones using our muscles. But in order to change the shape of an alveolus, we don't have muscles directly attaching to those alveoli. What we're doing is we're changing the pressures surrounding those alveoli in the chest. So we have kind of a cascading effect. So our intrapleural pressure is the pressure inside our pleural sac. So we're thinking about each lung being surrounded essentially by a bag. All right, so got branching to our two lungs. Okay. Cool. And we've got a sac surrounding the lung. Right, and it's double walled. One layer is on the lung, one layer is on the inside of your rib cage. Okay. And we need a pressure here in our pleural sac in order to make sure that the lung follows along with the rib cage as it expands and compresses. Okay. So that intrapleural pressure is going to allow that lung tissue to follow the chest wall, even though it's not directly attached with a lot of ligaments and stuff. And because that intrapleural pressure, or why that intrapleural pressure matters, why it pulls on the alveoli, is that we're creating a pressure difference across the wall of the lung, essentially, right? So we can think about there being a pressure difference here as well. And that's referred to as our transpulmonary pressure. So transpulmonary across the lung, okay? So this is a distending pressure, meaning it's a pressure that causes the lung to change shape, to distend, to expand, really. And that transpulmonary pressure we find by subtracting away the intrapleural pressure, so the pressure inside this intrapleural sac, from our alveolar pressure, that pressure inside each alveolus, which sort of colloquially we're thinking about as our lung pressure, our pressure inside the lung. Okay. So since we're comparing our alveolar pressure to our atmospheric pressure in order to figure out whether we're inspiring, breathing in, or expiring, breathing out, we want to think for a second about typical atmospheric pressure. Okay. So typical atmospheric pressure is about 760 millimeters of mercury. That's at sea level, so we're going to have some changes in pressure based on your location. The pressure of the atmosphere does change as you get up to the tippy top of a mountain. So we see changes in pressure with changes in altitude. And that change in pressure would also happen if you go below sea level. So if you have like an oxygen tank and you're scuba diving, that would make a difference. That would be changing the pressure around you. So we have pressure systems that kind of regulate that pressure. But if you are dropping below sea level on land, you're somewhere really inland, that would also kind of change pressures. But typical day to day in any given room in your daily life, you're not going to be experiencing large changes in atmospheric pressure. This means that we can kind of wave our hands about atmospheric pressure a little bit. What we really care about is how our lung pressures compare to the atmospheric pressure surrounding us. So whenever we see pressures from this point forward, we're really going to be giving relative pressures. So what I mean by that is basically we're going to be subtracting away atmospheric pressure from any large number we get. So we're setting our atmospheric pressure, whatever it happens to be, usually 760, to 0. So when I tell you the intraalveolar pressure is 1, what I'm saying is its absolute pressure would actually be like 761, but we only care about how different it is from our atmospheric pressure. So we just give our relative pressure. So if we just have 1 little millimeter of mercury difference, we just give that pressure as 1. All right. So atmospheric pressure surrounding us, pretty unchanging. Intraalveolar pressure is going to change throughout your breath cycle. So this is the pressure of the air in the alveoli. So a reminder of where our alveoli are, what they look like, and those little sacs, right? So we're coming down. Respiratory bronchiole has maybe 1 or 2 of them kind of on it, but most of our alveoli look like these clusters of grapes kind of at the end of those respiratory bronchioles, okay? And that's where our main gas exchange is happening. So that's where we really care about the pressure, because that's where we really care that we're getting fresh air, okay? So we're going to give our intraalveolar pressure relative to the atmospheric pressure. That makes our lives easier because we don't have to deal with looking at big long numbers, basically. These numbers are not even really going to get into our double digits. We're going to keep single digits pretty much when we're looking at these relative pressures. Easier for us. We're seeing this intraalveolar pressure vary with our phase of respiration, right? Okay. So since we have set our atmospheric pressure to 0, right, because we're giving these as relative pressures, right? So atmospheric pressure, we're always going to figure out how to make that 0. Just change everything else. Okay. This means It's going to be super easy to tell whether we are in the inspiration phase or the expiration phase, because if we're breathing in, we're pulling air in. Right, all we're doing is comparing atmospheric pressure to pressure inside the alveoli. So any negative number, right? Any negative, right? Anything less than 0 for our PALV, our alveolar pressure, means you're breathing in, right? So negatives are always less than 0. So that's our pressure gradient from 0 in the atmospheric pressure to our negative pressure inside the alveoli, drawing air in. Opposite is also true. So anytime we have a number greater than 0, AKA any positive number for an alveolar pressure, means that if we have some positive number in the alveoli compared to 0 outside in the environment, it means we have a higher pressure in the chest. So you're gonna breathe out towards that 0, towards that lower number. So when we're thinking about, are you breathing in? Are you breathing out? All we're comparing is the alveolar pressure and the atmospheric pressure. And it really is that easy. I'm going to repeat that a bunch because I've seen people get confused by all the other pressures on our list of pressures, but really just those two numbers that you have to pay attention to. Since we're mostly giving these pressures in relative pressures, it's really just the sign on that alveolar pressure that you mostly have to pay attention to. All right, that said, I want to make sure that we do understand what I mean by absolute pressure and relative pressure. So this is like the one time I'm going to give you an absolute pressure example. Okay. Let's go ahead and think about our absolute pressure in the alveoli. We're 764 millimeters of mercury. If our atmospheric pressure was our typical 760, we're going to have air coming in, or are we going to have air going out? Okay, let's take a look. Okay, cool. All right, so all we're doing is comparing PALV, which in this case is 764, to our atmospheric pressure, PATM, which in this case is 760. Okay, 764 is greater than 760. So this means our high to low gradient is high inside the lung, low outside. So in the future, when we give this as a relative pressure, this would be +4 versus 0. Right? This is why we're setting things to relative pressures, makes our lives easier. But this is the same situation. Right? This is our absolute situation. If you measured it like with some device, some barometer, that's the pressure you'd get. Relative pressures, just easier to look at, but same situation. Okay. Cool. All right, so now let's look at some relative pressures. All right, so if we have the relative pressure, PALV, of 15, are we talking about breathing in or breathing out? right, let's take a look. Okay, yeah. So this is a positive number, right? So positive number, 15, pressure inside the lung. We've said this is a relative pressure, so our pressure of the atmosphere is 0. Okay. So 15 is bigger than 0. So there's our gradient. High pressure in the lung again, lower pressure outside. We're breathing out. Air going from high in the chest, low to the room. All right, so let's try this one more time. Okay, so let's have a negative pressure. So if our relative pressure in the alveoli, PALV, is -10, would air go in or out of the lung? Okay, let's look. Okay, now we're on the same page. Yeah, so we have a negative number. This means that our PALV of -10 is less than our atmospheric pressure, which we've set to 0. I told you this is our relative pressure. Okay, so now we have a low number in the chest, and we're going to think of that as kind of like a vacuum sucking air in, right? So the high in this case is that 0 outside our body. That negative pressure in the lung is pulling air towards itself. So high to low still, but now we've changed whether we're higher than 0 or lower than 0. It really is that simple. We're just comparing these two numbers. We're just figuring out which one's bigger. Okay. So that was our atmospheric pressure, PATM, that we're setting to 0, and our alveolar pressure, so the pressure inside the alveoli of the lung, PALV. Those are the only two numbers we need to figure out. Compare which one's bigger to figure out whether we're expiring, breathing out, or inspiring, breathing in. Okay. But we do have other measurable pulmonary pressures, right? So intrapleural pressure, that pressure inside the pleural sac, right? So that is always negative under normal conditions. So that is the pressure that is helping us sandwich the lung tissue to the chest wall. So it's always negative, and it's always less than the alveolar pressure. So we're thinking about it like a vacuum, like a kind of suction situation, so that our lung just follows the movement of the ribs. Okay. So it is going to vary. So it changes with your phase of respiration. When you're resting, it's -4. It's always going to stay negative if things are normal, right? Like if you have a stab wound and a pneumothorax, it might get above 0, but, or sorry, yeah, it might get to 0 or above, but that would be a big problem because this is the pressure. This negative pressure is allowing our lung to follow our directions when we move our chest, when we move our muscles. Okay. The reason it's negative, so you want to think about like, if you're making a microscope slide, hopefully you've done this at some point, right? You put a little bit of water, you put those two pieces of glass together, and just that water kind of sticks it together, right? This is the same kind of situation. There's a little fluid in the pleural sac, so in this intrapleural space, okay? So that's kind of our stickiness. And it happens to be the case that your lungs, when they rest, right? Like, so after they expand, if they're at rest, they tend to bounce back in, but your chest recoils outward. Your chest tends to bounce back out a little bit. So we have these forces that are kind of pulling in opposite directions, and we need the surface tension of that intrapleural fluid and this kind of negative pressure to sandwich everything together, to stick everything together. Okay. So this is preventing our wall our chest wall and the lungs from pulling away from each other. So here we're just looking at your book's picture of what all this looks like. So we see those little yellow clusters of grape-like alveoli, and we're taking a cross section across the lung in purple, the intrapleural space here in blue, and then the chest wall in red. And we're zooming in here. All right, so here we can see that at rest, we've got an intraalveolar pressure of 0. All right, so when our intraalveolar pressure is 0, we've set the atmosphere to 0, right? So that's when you're just kind of resting. You're not moving air in or air out. You can kind of feel what that feels like in your body, right? You know that you can make those two pressures equal, okay? When we're at that point, we still want our lung to be touching our chest wall. So we still have this negative intrapleural pressure pulling the lung and the chest wall to each other as the chest wall recoils and relaxes a little bit here. Okay. So we can note that if our intrapleural pressure is always negative, and the way that we are calculating transpulmonary pressure, right? So this whole pressure across the wall of the lung, right, is by taking our alveolar pressure, so PALV, in this case 0, right, and we're subtracting away, under normal conditions, a negative number. So at rest here, we've got our -4. This means we're going to create a positive transpulmonary pressure, so like a force for distending the lung, a force for expanding it, a force for gluing it to that chest wall, even though we're not using actual glue, right? So here we can see that with that negative intrapleural pressure, we get a positive transpulmonary pressure. So that's what we typically expect. So at rest, that transpulmonary pressure, that force that's kind of binding together our lung tissue and the chest wall, is about 4. So we're just looking at this again. So this is what would happen if we pierce the chest wall, right? And everything likes to come to equilibrium. So if you pierce the chest wall and now the air in the atmosphere around us can communicate with the air in that intrapleural space, we're going to get rid of that negative number in the intrapleural space and everything's going to come to rest at 0, right? So at that point, you have a problem, right? So at that point, you don't have this pull on the lung tissue to sandwich it to the chest wall. And this is what happens. So this is a pneumothorax. Pneumo is for air, thorax is for your thorax, okay? So in this case, all our pressures have equalized, right? So atmospheric pressure, we set to 0. Here we can see our intrapleural pressure has come to equilibrium with that atmospheric pressure. We were at rest to begin with, not breathing in or out. So our alveolar pressure was at 0. And you can immediately see the problem. That lung has gotten small, it's gotten shriveled, it's not touching the chest wall anymore. Right? So we are not going to be able to oxygenate our body sufficiently here with that lung, right? And we don't have the ability to pull on that lung tissue anymore. So that's why our transpulmonary pressure is important. It's driven by the difference between this alveolar pressure and the intrapleural fluid pressure, basically, okay? And so it's creating this kind of pull on the wall of the lung in order to keep that lung wall sandwiched to the chest wall, okay? So when this transpulmonary pressure changes, which it will change, right? Because we can change our alveolar pressure and we will see that intrapleural pressure changes as well, right? So both of these are variables that we would expect to see change. So when we see these two values change, we see the transpulmonary pressure change. That increases our distending pressure on the lungs, so that pressure that causes the lungs to deform, to change shape. which is great because we're going to use this to make our alveoli bigger, which is how we change our alveolar pressure a bit more, changing their volume to change their pressure. Okay. So diving in a bit more. All right, so our force for flow is our pressure gradient. All right, so flow is always equal to a difference in pressure divided by some resistance, as you can see at the bottom now. Right, our difference in pressure that we're thinking about is the difference between our atmospheric pressure and our alveolar pressure. Okay, so we know that pressure, the flow is going to be happening from high to low pressure. Right, so a low pressure, when we're thinking about an alveolar pressure, is going to be a negative number. So say imaginary alveolar pressure. I'm going to make this one -4 just for kicks. Okay. All right. So this would give us 0 minus a lower pressure. So minus -4. All right. So that would give us a positive number up here for our difference in pressure, divided by some number for our resistance. But here you can see why we have a flow happening here. I'm not going to ask you to do that calculation in the future. I'm just pointing it out that that's what's happening here. Okay? So your atmospheric pressure is remaining constant during your breath cycle. Only the alveolar pressure changes. So the alveolar pressure is the one that's creating our gradient. If it's positive, our gradient is high in the lungs, low for our 0 atmospheric pressure. If we have a negative number for our alveolar pressure, we've got high, 0 in the atmosphere. Negative pressure in the lungs is our lower number. Okay? And the way that we are changing this alveolar pressure is by changing the size of the alveoli, which we do by changing the size of our chest, the size of our thorax. That transpulmonary pressure allows the lung to follow along with the chest wall. Okay? And when we change the size of a container, when we change its volume, right, we're going to see a relationship of the volume of a container to the pressure inside that container, right? So we can think about this intuitively, right? If you have a small container with a lot of stuff in it, that's a high pressure situation, right? You're feeling very cramped, you're feeling very under pressure, kind of constrained. We have a big old container with not very much stuff in it. That's going to be under low pressure. You have lots of room to move, float around if you're some little air molecule. Okay. So we'll talk about Boyle's law, but that's basically the gist of it. There's an inverse relationship here. You have a big volume, it's going to be low pressure for any given amount of air inside. If you have a small container, a small alveolus, a small chest, for any given amount of air, that's going to create a higher pressure. Okay. So we're going to be changing these alveolar pressures by changing their volume. So we're going to make the alveoli big to drop the pressure and suck air in. We're going to make the alveoli small to make high pressures push air out. Okay. When we come back to resistance, we're going to see that the resistance is coming really from our airways. So we talked about the conducting zone and the respiratory zone. We saw this series of splitting tubes getting us eventually to our air sacs, to the alveoli themselves. Okay. So we're going to see that just like our arterioles, our airways can change radius, right? And radius is going to work the same for an airway the way it did for an arteriole. Small radius, high resistance, big radius, low resistance. Oops. But before we get there, let's take a couple minutes to think about these pulmonary pressures in a bit more detail, because these really are driving our breath cycle. So if these don't make sense, we're going to get a little lost as we start to think about what can change, what can vary, what do we measure. We're going to walk through 3 scenarios. I've given you some numbers here. So we're giving relative pressures. So I've set the atmospheric pressure to 0 for all of these scenarios. Okay. And we're going to look at differing alveolar pressures. Okay. So we see a -1 here in scenario 1, +1 here, scenario 2. And we're going to figure out what happens when it's 0 in scenario 3. We've given our intrapleural pressures as well. So all negative numbers here, some differences between them. So what I want you to do for me is I want you to tell me, for each of these scenarios, do we have air moving into the lung or out of the lung, or not moving? That's an option. I want you to go ahead and calculate the transpulmonary pressure for me as well. So the pressure that's gluing our lung tissue to the chest wall. I'll give you a few minutes to do that. You can work it with a neighbor if you want, or do it on your own first, then compare, and then we'll circle back and I'll do it together. Okay, let's start to take a look. So we'll start with this first scenario. Okay, so what we're doing first, always first, we're comparing atmospheric pressure and alveolar pressure. Okay, these are our first 2 numbers that we pay attention to. Okay, and if you were to get a written scenario, say on an exam, right, you can always assume the atmospheric pressure has been set to 0 if I'm giving you pressures that don't start with like 700. Okay, so atmospheric pressure, 0, which means that we can just look at the sign on our alveolar pressure to tell whether air is going to move in or out, inspiration or expiration. So in this case, we've got a negative alveolar pressure, so it's lower than our atmosphere, pulling air in like a vacuum towards that negative space. Okay. So air movement goes in this situation. if we wanted to calculate out our transpulmonary pressure, make sure that that lung is sticking to the chest wall, we would subtract our intrapleural pressure from our alveolar pressure. So we've got -1 minus -5, so +5. So we'd have a transpulmonary pressure of 4. Okay. So we don't need to know that transpulmonary pressure if all we're trying to tell is our air movement, but it is necessary for your body that that transpulmonary pressure exists. So for scenario 2, we're just doing the same thing, right? So we're looking at, is this alveolar pressure above or below our atmospheric pressure? We've set atmospheric pressure equal to 0, so we can just look at positive or negative. This is a positive number, so it's higher than our atmospheric pressure, so we are breathing out. Okay? So if we're trying to figure out breathing in or out, that's all we need to know. But your body cares about this distending pressure across the lung, so we can also notice that we still have a distending pressure across the lung where we are still sticking the lung to the chest wall. Right? So when we subtract our intrapleural pressure, it's always negative. Right? So we've got a 1 plus 4 equal to 5. Okay, so we've still got some force keeping that lung with the chest wall. Final scenario is the same, but we are looking at a system where we are at rest, right? So our alveolar pressure and our atmospheric pressure are equal. This means we have no pressure gradient, so no flow is happening. We're not moving air in or out of the lung at this point. We're at rest. But even at rest, we still have a negative intrapleural pressure, right? We don't need that pressure if we're just trying to figure out, are you breathing in or out, right? But we do need one in our body because we still need that lung to stick to the chest wall. So 0 minus a -6 is a +6. So that's how these work. So when you get problems with these, you may have some or all of these values given to you. Pay attention to the question. If all you're trying to figure out is, are you breathing in or breathing out? Ignore everything except for that alveolar pressure and whether it's bigger or smaller than our atmospheric pressure, which is always set to 0 when we're giving these relative pressures. All right. So coming back to our relationship, sorry, way for you, our relationship between pressure and volume, right? We're going to be changing that alveolar pressure, making it positive or making it negative by changing the size of the alveolus, so by changing the volume of a container that contains some gas, okay? So this follows our ideal gas law, okay? So here we see our ideal gas law up top. So what we're looking at here for our ideal gas law, pressure is this P. V is our volume of the container, so the size of our container, the size of our alveolus. Okay. N would be your like moles of gas. So N is the amount of air. Okay. R is a constant, so that's not going to change. T is temperature. We're not going to be paying attention to temperature for this either. Okay. Ideally, we've made our temperature nice and warm and humid and constant for our body. Okay. So what we really care about for any given volume of air, we're going to see that we've created an inverse relationship between pressure and volume, right? So for any given volume, so long as we don't pull air in or push air out, which we will do, but for that given volume of air, if you start, or given amount of air, sorry, I'll try not to use the word volume because that's going to get confusing because we're also talking about volume in the container. Okay, so if we've got a certain amount of air, we've got a container of a certain size, we're going to have a certain pressure. Okay, so in this case, we've got a pressure of 1 times a volume of 2 is going to give us some number, this nRT. I'm just going to write an X because we're not going to change any of these values right now. Okay. Now, if we shrink that container, so we're thinking shrinking down our alveolus, right? Before any air moves in or out of your airway, right? When we still have that same amount of gas, when N is the same, the number of moles is the same, AKA we still have that same constant, that same value over here for this nRT portion. All right, now when we have a volume of 1, right, we've cut this in half, right? To have this all stay the same, our pressure doubles, right? So 1 times 2 is the same as 2 times 1, right? So we've got this inverse relationship here. Okay? So we could also kind of express this in a different form if we wanted to reshape this. All right, so PV equals, since I put an X down here, I'll just put an X here, but it's nRT total, right? But if you wanted to find the pressure, it's going to be that nRT, right, divided by the volume, right? So here's that inverse relationship, right? So we've got like 1 over V here, or we could do it the opposite way with our pressure. Okay? So they're the opposite of each other. If we have a big pressure, that's probably a small container. If we have a big container, that's probably going to be a small pressure. And it's coming from this ideal gas law, which is just a thing that is true in the world about how gases behave. Okay. So this means that by changing the size of the alveolus, so the volume of the container, we can change the pressure on the air in that container, which is great because we want to propel air in and out. Okay. So when we think about what is creating our intraalveolar pressure, that PALV, we're going to be thinking about the volume of the alveolus, so the size of the container, right? And we will also have to account for the quantity of air in the alveoli. So in our ideal gas law just now, that was N, right? So when we start our breath cycle, when we start to change the volume of the alveolus, for a little while, that quantity of air is going to be unchanging until we create a pressure difference with the environment, at which point we are going to have movement of air. So there's going to be some shifting happening. Okay. So we're going to start by changing volume of our alveoli, so our size of the container. So when we expand our lungs, when we make them bigger, bigger container, bigger volume, lower pressure. Okay. So PALV, our pressure in the alveoli, our alveolar pressure, drops down when we make our alveolus big because we made our lung big. Okay. So this is how we pull air into the lung, right? We drop that pressure in the alveolus down, make it negative, make it below our atmospheric pressure, starts to pull air in. At a certain point, we're going to pull enough air in that we get back to kind of equal pressures. Then our lungs are going to recoil. That alveolus is going to get small, right? So for a little while, we're going to have that same quantity of air in the alveolus that we just did now and we stopped breathing in. And we're compressing that alveolus down as our lung bounces back and gets smaller. So this is what creates a positive pressure and pushes the air out of the lungs. Okay. So big lung drops down our pressure, negative number, pulls air in. As our lungs recoil, get smaller, compress, we're pushing the air out. Okay. So once you think about this and think about it like with your body for a little bit, hopefully this will be pretty intuitive because you can kind of feel these pressures when you breathe as well. Okay. If we looked at this in graph form, it's a little less intuitive, but it's just expressing the same information that you can actually kind of feel in your body. So let's take a look at that. Where's my, there we go. There we go. Okay. So inspiration, air moving in, expiration, shipping them on out. That's your X, right? Okay. So we're starting out at equilibrium. So our intra-alveolar pressure is 0. We don't have to write on any atmospheric pressures here because when we set these as relative pressure, atmospheric pressure is always 0. Okay. So when we're starting out in between breaths, pressure is equal. Now we start to make this alveolus bigger. That's what these arrows are about, right? So we're pulling the lung open, making it larger. Right? You can see for a little while, we have the same amount of air. So that same N, the same number of moles here as we started with, but this container got larger. So that creates our negative pressure. That creates this pressure difference because this pressure drops down. Right, so we sank down as this alveolus got larger. Now you can see our breath volume, so the amount of air in the lung, is getting larger for every little incremental bit of negative alveolar pressure we're creating. So as we're expanding, you do see air start to come in. So we start to see some variation. So at this midpoint here, where we turn from red to yellow, where we turn from inspiration to expiration, you can see that even though we have a large alveolus, a large container, we've got more gas in it, so more individual air molecules here inside. Okay. And at a certain point, they come to equilibrium. There's only so big you can make your alveoli. There's only so deep you want to breathe in, right? So just like small alveolus can have that air at equilibrium with the atmosphere, so can this large alveolus, right? So that's the top of your breath, the most air you breathe in during the breath cycle before you start to breathe out. Okay. So as you breathe out, in order to breathe out, you shrink down the container, right? So that's what these arrows are. We're shrinking down the alveolus, making it smaller, compressing the air inside. That means we're raising the pressure in the alveolus, right? So our pressure is becoming positive, okay? As that pressure is positive, that means it's above atmospheric pressure. That means we have a gradient, positive pressure, high pressure in the lung, 0 pressure outside, lower. So we push air out as we push that container smaller. So here you can see that breath volume going down. Okay, so our air is leaving the lung. So the amount of air in the lung is changing. All right, we have a peak here at this alveolar pressure of 1, still positive for a while as that air is out, but eventually we come back to 0. All right, so we come back to rest at the end, back to where we started. So that's what's happening when you breathe. Next time we'll run through it again and think about the muscles that are driving this. So let's make sure we understand the pressures. That's really the crux of this unit. So